Examination of the knee. Start by inspecting the patient's knees. Get them facing you, look for any signs of swelling, abnormality, bony prominence, scars from previous surgery or injury, and as I say, any asymmetry between the two knees. You can ask the patient to turn around, and again compare them at the back, again looking for any gross abnormality. Next, if you can assess the patient's gait, so the best way to do this is if you just like to walk away from me, and then walk back towards me. At this point, you could also ask to see the patient's shoes to look for any abnormal wear, which again would suggest an abnormal gait. So next, what I'm going to get you to do is bend one of your knees up, and then I'm going to make you squat down to about 90 degrees of knee flexion, and I'm just going to have a look for any signs of varus or valgus stress on your knee. So if you bend your knee and then just squat down and then stand back up, if there is any abnormal stress or lateral movement, that can show signs of a predisposition to an ACL injury. So next, move on to the couch if you'd like to lie on your back. So it's sensible to start by examining the joint above, which is the hip. Do you have any pain in your hip at all? So you would expose the patient a little bit more than this and have a look for, again, any gross abnormality around the hip, signs of swelling or bursitis. And then you can palpate the hip joint just out the greater trochanter and the ASIS to the groin, and then just test the range of movement. So if you keep your knee straight, can you lift your leg in the air and then put it back down? And can you bend your knee and bring your knee up towards your chest and then straighten your leg back up? And if you keep your leg straight, can you bring your whole leg out this way towards me and then put it back and cross it over your other leg? That's fine. So I'm quite happy with the hip, so we can move on to the knee. So again, a bit of a closer inspection, any gross abnormalities, signs of effusion. If there is what looks like an effusion, you can compress it a bit more from the top near the quads, and then push it to one side, and you can sometimes feel it a bit more easily. Then palpation. So start by palpating the quadriceps muscle, and then down to the quadriceps tendon, to the patella. Check for laxity of the patella, see if there's any much lateral movement or instability. Then down to the patella tendon, tibial tuberosity, and the lateral joint line, the medial joint line. And then we can assess range of movement of the knee. In fact, I'll just get you to flex your knee a little bit, just bend your knee up a little bit. Just have a feel in the popliteal fossa. Check for things like Baker's cyst or rarely popliteal aneurysms. That's fine, you can straighten your knee back up. So to check knee extension, if you just try and push your leg down into the bed as much as you can, okay, and then if you can bend your knee as much as you can, bring your heel towards your bum, so knee flexion, that's fine, and we can check your ligaments. So initially looking at the anterior cruciate ligament, if you just like to straighten your leg a little bit more, if you hold the patient's femur, with your other hand stabilise the tibia, and then just try and bring the tibia out towards you, see if there's any laxity or the patient complains of any discomfort. And then for the posterior cruciate ligament, just bend your knee a bit more. I'm just going to push your knee back towards the bed. Okay. Then if you just like to extend your leg but not quite fully, we can assess the medial collateral ligament by applying lateral force, and then the opposite by applying the medial force to assess the lateral collateral ligament. To assess the ITB, you can do Ober's test. So what I'm going to get you to do is, if you roll onto your side facing the wall, bend both of your knees up towards your chest a bit, okay, and just lie your head down flat. Then I'm going to extend this leg and then let it come back down to the bed. If the iliotibial band is particularly tight, sometimes that can be painful, or you physically can't get the leg down that far. Okay, that's fine. You can roll back onto your back. Also worthwhile checking hamstring tightness. So if you could, roll onto your front please, and then just let your legs hang off the end of the bed this way. Okay, a little bit further. If the hamstrings were particularly tight, you might find that one leg is unable to extend as well as the other. Okay, that's fine, you can roll back over, sorry. Now I'd like to examine the menisci, so we'll start with McMurray's test, aiming to feel a clicking or a locking sensation in the knee by trying to catch the menisci between the tibia. Okay. And another way to test the menisci is Apley's test. So if I could just get you to roll back onto your front, sorry. And then flex the knee at 90 degrees. Apply a bit of tibial rotation. And sometimes a bit of downward force, can elicit this more. Again, looking for a clicking or a catching sensation. That's fine, you can roll back over, thank you. And finally, we'll just test the neurovascular status of the leg. So dermatomes L1 down to S1. I'm just going to touch your leg. If you can feel it, just say yes.
Yeah. Yeah. Yeah.
Okay, that's fine. We can just check the pulses. So the popliteal pulse is if you just like to bend your knee. You would have felt this when examining the popliteal fossa before, but just try and feel for the popliteal pulse. And then just straighten your leg. And the dorsalis pedis. And if you can feel the dorsalis pedis, then the tibialis anterior would be fine. I'm just going to check the power of your hip first. So if you keep your knee straight, I'd like you to lift your whole leg up towards the ceiling. I'm going to try and push it down, you keep it up. That's fine. And then push your heel down towards the bed. That's fine. And then if you bend your knee, try and kick out against me and try and bring your heel back towards your bum. That's fine. And straighten your leg. And bring your whole foot towards your nose and push my hand away. That's fine. And that's everything. That concludes the knee examination. Thank you.